Hello and thank you for joining us on Journalist Hangout on Sunday. I am Olajumoke Olatunji. Today on the program, Finnish government seizes Simon Ekpa's assets over terror allegations. Defense chief deploys special force to Sokoto and Kebbi states for operations against the Lakrawa group. And later on the show, Nigeria moves closer to state policing as majority of governors agree. A security consultant, GD Omeje, will join us later on for that discussion. Today, I will be hanging out with Adewale Adeoye and Mayor Akinpelu. Gentlemen, good afternoon to you. Happy Sunday and welcome to Journalist Hangout on Sunday.
Thank you.
Journalist Hangout starts now. Thank you very much for staying with us. It appears the commitment of Kaduna State to improved healthcare delivery is setting a new standard in northwestern Nigeria. The state has emerged as the best performing state in primary healthcare, winning a cash prize of $500,000. While receiving the award at the gala night organized by the Nigeria Governors Forum, the State Deputy Governor, Hadiz Balarabe, noted that the award is a proof of the commitment of health workers to transform healthcare delivery in the state. Gentlemen, effective primary healthcare is about the people. Let me start with you, Mayor.
It's something very commendable because the most important in the healthcare chain is the primary healthcare, because that is what takes care of people, especially in the rural areas. And that is one aspect that most states have really ignored. Most times it's local government that gets involved more in healthcare delivery, and they don't have the resources to be able to make it very effective. So when you see a state that has invested a lot of money in primary healthcare, it's something that is very commendable because that is the most important part of the chain. And yes, people can go to state hospitals or teaching hospitals, but you will notice that in most states, people do not, the distance between where they live and the capital, where usually you have
the teaching hospitals
yes, it's quite far. So it is the healthcare, at least at the initial stage, that are able to take care of something. And then when it is more than what they could handle, then they can do referral. So it's a very commendable thing, and that will encourage other states to be able to do that. I'm particularly impressed that a state from the north can win that prize, beating all the other states to healthcare delivery is something that's very commendable.
All right, Adeoye, you know, indeed, they say complex problems are not impossible to solve, because I know that as of last year, Kaduna State had major challenges. I talk about insufficient number of health workforce, inadequate supply of health equipment, and poor regulation of private health facilities. The state is winning this a second time in a row.
Yeah, I think this is quite commendable. Health is wealth. A healthy nation is a wealthy nation.
Absolutely.
And I think we should also look at Kaduna State in context. Kaduna is facing a lot of challenges, security challenges, that almost come to the conclusion that any development is very difficult. But the governor has been able to brace the tape by creating milestones, especially in health area. There are 23 local governments in Kaduna State. And Kaduna, by the last census, has a population of about 9 million, more than 9 million people. Now, the state government has created 1,068 health centers, in the state. If you divide that by an average 23 local government, that will give about 46 health centers, in each local government. So I think that will make public health to be accessible to rural communities. They don't need to come to urban centers before they can access, because it's a major problem. Postnatal care, emergency cases, people need to travel several kilometers looking for, vehicles that will take them, So, but now that you have a situation where your local government, your community, you can, have direct access to public health, I think this is quite commendable. And the people giving the award, they are not just people driven by personal interest. I mean, Bill Gates Foundation, it are all involved. So it's not a kind of a wolf award. It's a globally recognized award. So I think I say kudos to Kaduna State government and the people. And I hope that people will realize that when we are talking about security of a state, provision of health is a major thing, because it means that we are going to increase life expectancy rate. They are going to deal with issue of mortality rate and all that. So I think it's quite commendable. It's a key area that if any government can focus on health, it will have made a significant impact in the political economy of every state.
All right. Before I go back to Mayor, so how do you charge state governments to continue the healthy drive to outdo themselves when it comes to taking care of the citizens?
Well, they need to realize that in the first place, when you are having the yearly budget, a lot of funds needs to go into public health. Because when people don't have access to public health, we are talking about the consequences death.
You think there's been like an improvement from what we used to have?
Yes, there's a significant improvement now. And we are battling with malaria, all sorts of diseases. So if government can put a lot of funds into health, we will have been able to resolve a lot of security problems. That not necessarily has to do with whether people are being killed or being kidnapped. But people can access good health. That means that they are going to live longer. And their children will have better access to good health and all that. So I think it's a key area of human development, public health. So I really commend what the state government is doing, and I hope other states will take a cue from Kaduna State. And I believe this will encourage you to do more in the area of public health.
All right, Mayor, talking about other states, same question. How do you charge other state governors in continuing to do more, outdo themselves in taking care of their citizens when it comes to public health delivery?
I think they should take health delivery more seriously, which I think most states are not doing. If you look at the budget for health, even at the federal level, is not what it should be. To me, for example, I think that the three major key areas that government should concentrate on should be education, health, and infrastructure, through roads and all that. I think that is what they should concentrate on. But a lot of states do not spend enough money on education and health. And if you notice that, especially as it affects toddlers and young people and women with women that has to take care of little kids, most of the activities in that area is sponsored majorly by foreign donors. You understand? It's majorly by foreign donors, and especially the Big A Foundation. They concentrate more on health things, inoculation, and all that. So I think most states should try to do better. And they should use a template by Kaduna, because you see, if you have it almost accessible in every community, though it will take a lot of money, but they should make sure that those health centers are functional, not just to open a small place and put a nurse, or even there won't be a doctor there. But if it is properly manned, it will solve a lot of problems, because health is extremely important. And state governments should try and spend more money in providing health delivery.
Let's talk about federal government, because Coordinating Minister of Health, Ali Pate, was at that event and identified some of the challenges: health expenditure, immunization gaps. How do we continue to address this as a nation?
Yes, that's the secret is what I just mentioned earlier, by voting more money to health delivery. Because you see, both the federal government and state government, education and health, when you look at the budget, do not take the kind of money that they should invest in those areas. And especially, for example, when you look at, that's why I said, if not for people like Bill Gates and all that, spending so much money in that aspect of it, it will have affected a lot of people. Because most times when you see inoculation and all that, and things that they do after postnatal activities, you see that it's usually foreign donors that providing funding for such things, which should not be. The funding from foreign donors should be added advantage to whatever activity is going on in those states.
All right, thank you so much. Adig, any final take on this before we move on?
Well, we commend the governor of Kaduna State, and we hope we'll be here to discuss more about how the governor has been able to improve on the current situation in terms of public health.
All right.